What exactly is bronchitis? Is it contagious? How do you treat it? And, more importantly, how can you avoid it? Let's break it all down using 100% real medical facts. Bronchitis is the inflammation of the lining of your bronchial tubes, which carry air to and from your lungs. When these tubes get inflamed, they swell and produce mucus, making it harder to breathe. There are two main types: acute bronchitis, which is short-term, and chronic bronchitis, which is a long-term condition, and a form of chronic obstructive pulmonary disease, or COPD. The main causes of acute bronchitis are viruses. The same viruses that cause colds and flu. Bacterial infections are less common, but they can happen. Meanwhile, chronic bronchitis is almost always caused by long-term exposure to irritants, like cigarette smoke, air pollution, toxic gases, or dust. Or, is bronchitis contagious? Here's the truth. Acute bronchitis caused by viruses is contagious, just like a common cold. You can catch it through coughing, sneezing, or touching contaminated surfaces. Chronic bronchitis, however, is not contagious. It's caused by long-term lung damage, not by germs. So, how can you prevent bronchitis? Well, doctors recommend a few key steps. First, avoid smoking and steer clear of secondhand smoke whenever you can. It's also important to wash your hands frequently, since that helps prevent viral infections. If you're around dust, fumes, or folks who are sick, wearing a mask is a good idea. Getting your annual flu shot is really helpful too, because influenza viruses can trigger bronchitis. And honestly, boosting your immune system by eating healthy, staying active, and getting enough sleep makes a big difference. Treatment for acute bronchitis usually focuses on relieving symptoms. Doctors recommend getting plenty of rest and staying hydrated. Over-the-counter pain relievers like ibuprofen or acetaminophen can help, and cough suppressants might be useful for nighttime relief. If you have wheezing, inhalers can be prescribed. It's worth mentioning that antibiotics are usually not needed, unless there's a confirmed bacterial infection, because most cases are actually viral. Now, for chronic bronchitis, treatments include prescription inhalers to help open up your airways, pulmonary rehabilitation to improve your breathing, and oxygen therapy if your case is severe. And of course, quitting smoking is the #1 priority. So here are the final takeaways. Bronchitis is pretty common, and while acute cases are usually mild and clear up in a few weeks, chronic bronchitis is a serious disease that needs lifelong care. Protect your lungs, treat infections early, and don't ignore a cough that sticks around longer than 3 weeks. If you're ever unsure, just see a doctor. Thanks for watching. Don't forget to like and subscribe for more fact-based health videos. Stay safe and breathe easy.